Can chronic pain be healed naturally without steroid shots or surgery? The answer is yes. In this video, I'll show you how. Welcome back to the Dr. No Pain channel, where we can fix your pain using your own body to heal itself so you can perform a barbell deadlift. Hi, I'm Dr. Thanh Nguyen, a medical doctor board certified in internal medicine, practicing here in sunny Phoenix, Arizona. If you had a recent car accident, your treatment may be at no cost to you. So let's dive in. Lower back pain is one of the most common problems I see in my clinic. And here's the good news. For most people, back pain can be completely healed and stay gone for good. But that is only if we find the real source of the pain and treat it the right way. If you've had procedures in the past, maybe injections, medications, or even surgeries, but your pain keeps coming back, chances are the wrong spot was treated, or maybe the treatment only covered up the pain temporarily instead of helping your body heal itself. So where does lower back pain really come from? In most cases, the pain isn't from a pinched nerve like you might have heard. It's actually from a tiny joint at the base of the spine called the L5S1 facet joint. Don't worry about the fancy name. Just think of it as the hinge joint where your spine meets your pelvis. When this joint gets injured from a car accident, a sports injury, lifting something heavy, or even a hard fall to the ground, the bones can rub against each other. That rubbing is what causes sharp pain. So how do we fix chronic low back pain? The best results I've seen come from what we call regenerative treatments. Instead of masking the pain with medications like steroids, these treatments actually trigger your body's own natural healing. My favorite technique is called PRF with albumin gel, or platelet-rich fibrin with albumin gel. In simple terms, we take the healing cells from your own blood, concentrate them, and then place them right at the injured site. Your body does the rest. It repairs itself. Why do we believe platelets can fix your pain? It is because platelets are already a natural part of your healing process. Any injury in your body, whether it be from a cut on your skin, or a bruise on your skin, or a broken bone, all of these injuries start with bleeding. The first step in the healing process is that the platelets stop the bleeding and then send a signal that tells the body to come heal the injured site. The platelets don't do the actual healing, but serve as an important red flag to attract your immune system, which then comes to fix the injury. The platelet protocol we prefer to use is called PRF with albumin gel. This is a third-generation improvement upon the more common first-generation version called PRP, or platelet-rich plasma. PRF differs in two main ways from PRP. The platelets in the third-generation PRF protocol stays where you inject it in the body because the platelets are bound to the albumin gel that is created from your body by heating parts of your blood called the plasma. Making the albumin gel is like heating an egg white, which turns the albumin protein in your blood into a gel. Secondly, the platelets in the third-generation PRF protocol can maintain a healing signal for about 2 or 3 weeks in the body as compared to the shorter 1 or 3 days from the first-generation PRP. Most injuries in the body requires more than just a few days to heal, which is why the longer duration of the third-generation platelet protocol is able to cause a complete healing in most patients. Since 2023, we have used this newer third-generation platelet protocol, PRF with albumin gel, and we have treated over 700 patients, and the high majority have resolved their pain completely and permanently. That is why I say yes, chronic low back pain can be healed naturally. Now here's where a lot of people get led down the wrong path. Many doctors blame low back pain on a pinched nerve or a bulging disc that they see on an MRI. But here's the truth. Most people with bulging disc have no real nerve damage. How do you tell the difference? True nerve compression usually means 24/7 numbness and leg weakness that never improves with position changes. That often does need surgery. But if your numbness comes and goes, like it gets worse when you sit but feels better when you stand, that's usually not a true pinched nerve, but more likely sciatica, which is a nerve irritation caused by weak gluteal muscles that surround the nerve. Sciatica can be resolved with simple strengthening of the glute muscles. The problem with most medical treatments for low back pain is that they target the disc. If doctors target the disc instead of the facet joint with a steroid epidural injection, that might be why it fails, because they're treating the wrong spot. So how do we know if the joint is the problem? There's a simple test you can try at home. It's called the Kemp's FACET compression test. Here's how it works. You stand straight up with your knees locked, slowly lean backwards, and bend to the right and then to the left while keeping your knees locked straight. If you feel a sharp one-sided pain at the base of your spine, that's a strong clue the L5S1 facet joint is the real source of your pain. So to recap, most chronic low back pain comes from the L5S1 facet joint. You can test this at home with a simple movement test. And the best natural solution I found is a regenerative treatment called PRF, which uses your body's own healing power. If you've been dealing with pain for more than 3 months, there's a very strong possibility we can resolve it. If you're in the Phoenix area, call or text our clinic to schedule an evaluation. For those living out of state, come visit us in Phoenix for a quick fly in and fly out injection on the same day, or a longer stay to explore our fantastic destinations like Scottsdale, Sedona, and the Grand Canyon. Your treatment will likely have no cost to you if you were in a car accident within 2 years or have a personal injury claim or a work accident claim. Contact us and we will help you figure it out. Other injuries can be treated with cash payment, as most health insurance does not cover platelet injections with the exception of TRICARE for active military. To summarize, we've accomplished some amazing breakthrough results with our third generation platelet protocol. A high majority of patients that we've injected have resolved their pain completely and permanently, and it appears to work in all body parts. We strongly believe that nearly all pain can be resolved by natural self-healing. In most cases, prescription pain medication won't be needed anymore, and surgery can often be avoided or postponed. You can be an active participant by sharing suggestions in the comments about what topics you'd like for us to cover or what information you are interested in learning. Your comments are a valuable space for offering constructive criticism or for letting us know your thoughts about our video. If you found this video helpful, please click on the thumbs up button and click subscribe now to support us in sharing these insights to help more people fix their pain naturally using their own platelets. If you have a friend or family member experiencing pain, please share with them this video. That's the end of this video. Thank you for watching. We'll see you in the next one. Peace.